Dr. Anthony Fauci, you are the nation's leading expert on infectious diseases. Thank you so much for joining us today.
Good to be with you.
So let's begin with the big news from Pfizer today, officially asking for emergency use authorization from the FDA for their COVID vaccine. It is now November 20th. Do you expect that we could see people getting vaccinated in early December?
I don't see early December. The way we're hearing it from the people who are more directly involved in the actual delivery of vaccines to the sites where they can be ultimately administered, it is more likely to be towards the end of December rather than early December. And the doses will be given in a priority order to people judged to be of the higher priority, ultimately by the CDC, the Centers for Disease Control and Prevention, but also with heavy input from an advisory committee that they use continually when they have to make decisions about the prioritization of vaccines. But I would say late December, much more likely than early December.
Who's going to get that first batch of vaccinations?
You know, that has not been determined finally yet. The ultimate decision will be in the hands of the CDC. And what usually happens is when an EUA is issued, then the advisory committee looks at the information in the EUA and makes an advice to the Centers for Disease Control and Prevention director, who then will make public what the priority list is. So we should be hearing about that reasonably soon.
Do you expect it's going to be healthcare workers and first responders first?
You know, I think it likely will be either they are first or simultaneously with another group. I don't want to get ahead of them, but they usually are among the very first priority.
When do you think typical families will be getting vaccinated?
Well, you know, it depends on what you mean, because within given families, there are people who are elderly, who have underlying conditions. They can move up in the queue and be earlier. If you're asking the question, when would a normal, healthy young person, let's say like yourself, be in there, who has no underlying condition, that likely will be as we get into April, mid-end of April, and then into the early spring, because you want to get through all of the other priorities first.
What does the vaccine news mean for reopening schools across the country?
You know, I think we should not depend on vaccines for reopening the schools. I think we should try to the best of our ability, in as safe a way as possible, that our default position should be to reopen the schools and to keep children in school, because the more we learn about the rate of infection in school, the more we see that it is low. However, a vaccine program in the community to lower the level of infection, or vaccinating teachers, for example, could make the children back in school be even more safe. So in some respects, it has an indirect positive effect on children going back to school.
If all goes according to plan and we see millions of people potentially vaccinated by early next year or heading toward mid next year, how much longer do you expect people will need to wear masks in public?
You know, that's a great question, but it really is going to depend on, we know we have an efficacious vaccine. In order to make an efficacious vaccine effective, you have to have a substantial proportion of the population to get vaccinated. Right now, we have a lot of convincing to do, because there is a lot of skepticism in the community when you do surveys about people getting vaccinated. If you get 50% of the population vaccinated, that's just not enough. You're going to be wearing masks for a considerable period of time. If you get the overwhelming majority of the population vaccinated, I don't think that even then you're going to completely abandon all public health measures, because there will be circumstances where you might have to implement public health measures, even if you are vaccinated and a reasonable proportion of others are vaccinated. So rather than looking at it as a complete substitution for for public health measures, you should look at it as a complement to that, so that they're not nearly as stringent as we need to have them now, but that they're still there in some manner or form to a greater or lesser degree.
Holidays next year, do you think people will still be wearing masks?
You know, I don't know. I hope not. I think if we get a good uptake of vaccines, and we have, like with measles, where the overwhelming majority of the population gets vaccinated, then I think we could have a very close to normal holiday season in 2021.
We've obviously seen reports of people in ICU beds with COVID who, till their dying breath, still believe that this is a hoax. First of all, what do you think of that? And also, are you concerned that millions of people still believe this is a hoax and won't get vaccinated?
Yeah, I am very concerned about that, Gabe. That's a very good question. It's astounding how what you said is true, that people who are in IC beds, people who are in the hospital, still believe it's a hoax. It's stunning that that's the case. It's almost unbelievable, but it is true because we are seeing that. That's going to make it very difficult for people to get their arms around this concept that you're dealing with a very threatening outbreak. And one of the tools that we now have available is a vaccine. And it just seems extraordinary that people don't want to rush to get the vaccine as opposed to being skeptical about it.
Does that anger you in your role when you're trying to educate the public? And there's a real risk there if people not only believe it's a hoax, but act on it by not getting vaccinated.
Yeah, I wouldn't say that it's anger, Gabe. I'd say it's really deep frustration because I'm a public health official, a physician who takes care of patients. My whole life has been devoted to the health and the safety of people in our country and in the world. And when you see something that you have as an enormously effective tool and people don't want to use it, it is quite frustrating.
The CDC is advising people not to travel for Thanksgiving this year, and yet we understand plenty of young, healthy people planning to get on airplanes, planning to travel to see family. What would be your message for people who are either traveling out of town or even going to see their family locally?
I think that each individual family unit, each individual person should make a risk-benefit determination regarding traveling or having people come to them after traveling in their home. I think each family, each individual is different because each has their own relative risk that they need to deal with. For example, if you have a situation where you want to have a big family dinner for Thanksgiving or for Christmas, but you have people in your home or the home to which you're going that are either elderly or have underlying conditions that put them at risk, you really want to be careful about that. You might want to say that this holiday season, as much as you would like to get together, you really better think carefully about the risk that you're putting people to and maybe just confine yourself to the immediate family unit. I'm not saying that that's a mandate of any sort, but people should at least do a risk-benefit determination before they do travel or have traveling people come into their own home.
Are you going to see your kids this Thanksgiving?
Unfortunately not. I mean, I've made that public because I've been asked the same question by others. I have adult daughters, 3 of them, living in varied parts of the country, different states, airplane rides away. They've made a decision. They're not going to come home because they don't want to put me, their father, at risk when they travel to get here.
You mentioned mandates. We've seen states that are restricting indoor gatherings to just people in your household. What do you think about that approach?
I really hope that people would understand the importance of these public health measures and these warnings about what you need to do to stay safe. When people don't adhere to that, and you're having a raging outbreak in your community, be it a state, a city, or a local community, sometimes at the local level, mandates of some sort are really necessary because people are not appreciating not only the endangering of themselves, but the endangering of society.
But those mandates, even the curfew that we're seeing in California, do you think those actually work to stop the spread?
They're not perfect. To me, there are multiple levels. You might say, close a bar or a restaurant. That's tough. Or limit the capacity of a bar or a restaurant. Or if I can't close it and I can't limit the capacity, at least limit the hours. So a curfew, though not the most effective way of doing it, it's better than nothing because it does diminish the time that people are exposing themselves to either transmissibility or acquisition of infection.
Businesses, families have invested millions in disinfectant products over the past few months. Is there evidence that disinfecting surfaces is actually making a big difference in terms of stopping the spread?
No, we don't have evidence that it is making a big difference, but you can understand why people want to do it because they know it can live on fomites and inanimate objects for a period of time. But I think people should appreciate that the overwhelming primary way of transmissibility is through the respiratory route and not by touching something. So there's nothing wrong with doing that, but there isn't a lot of overwhelming evidence that it has made a difference.
What specific policies would you want to see the Biden administration put in place on day one?
Well, the things that I keep talking about all the time. I mean, we're talking about the universal wearing of masks right now because we're in a big surge.
So you would want a universal mandate?
But it's not going to come centrally. I do not think it's going to come centrally. It very likely will come locally. Governors and mayors and people like that would do that. Again, mandates are difficult when you start telling people what to do. Sometimes they push back, and that's the reason why I have not been in favor of, not because I don't think it would be effective, because I think people would push back.
Yeah, talk about that for a minute. How has that visceral reaction affected the advice that you are actually, and the guidance that you're actually giving the American people?
Well, the thing that I'm very much, I would say, impressed in a way that's concerning is the depth of the divisiveness in this country about things that are public health measures that should be implemented and are common sense, that there are things that are to help you and those around you to be safe from something that is clearly a raging outbreak. The numbers don't lie. If you look at the surge that we're going, it's significant. On the other hand, we can do something about it. We know that mask wearing, physical distancing, avoiding congregate settings work because we've seen it in situations when you've implemented it, they work. And in situations where people don't implement it, you have surges. So it becomes frustrating when you see people don't relate to that and do it on their own. Then you get into the situation of if you try to get them to do something they didn't want to do in the first place, it becomes very problematic.
What have you learned about the power of disinformation over the past few months?
Well, disinformation is something that is obviously very detrimental to a public health endeavor. I mean, public health is something that should be based on solid information, evidence-based and data-based. And when disinformation gets disseminated, it confuses the picture and people really don't know who to turn to or what to do.
I can't even imagine the number of stories that you've heard from everyday people over the past few months. Is there any moment that's really stuck with you throughout this process?
Well, I think one of the things is something that you mentioned at the beginning of the interview, that even when the danger to one's own personal health and life is right looking at you square in the eye, that you can't recognize that that's not a hoax. It's not fake news. It's real. That's almost an unbelievable concept.
Are there any moments that you look back at and you think, I wish our team or I wish these government agencies would have handled this different because it might not have led to the politicization of masks and mandates?
Again, I don't want to get into that because that does get into the political issue. And the one thing I don't want is to have a soundbite distract from the message that I want to do. Not your soundbite, but someone will use it in a way that is distorting. And I've just been around the block too many times to let that happen.
A lot of parents are very angry with virtual learning. What do you think about the priorities we're seeing in this country from local jurisdictions where kids are at home learning on the computer, but I can still go down to the street and get a burger in a bar?
Yeah, I mean, that's something that is almost inherently contradictory. I think what we need to do, I've said that many times, is to the best of our capability to make our default position to try as best as possible to get the children to get back to school or to stay in school. The data is showing now that the rate of infection of children in school is low. Now, the detrimental effects both on the children and on society of keeping them out of school are substantial. So we need to try as best as we can to keep the children in school.
Are you going to get the vaccine as soon as you qualify?
Yes, I will. I will. I'm in a risk group.
Sorry, can you repeat that? We just had a note come up. Can you repeat? Will you get it?
Yes, I mean, if the FDA, who I trust, the career scientists there, and the independent bodies that examine the data, and my own access to it, examining the data, I would say that if the FDA approves the vaccine, I will definitely get the vaccine.
Thank you so much for your time, Dr. Fauci. Good luck, and we'll hope to talk to you soon.
All right, thanks, Gabe. Nice being with you.
You
Take
too.
care.
Take care.